Good afternoon, everyone. Welcome to Jefferson County Health Department Board of Trustees meeting, January 23rd, 2025. Welcome to the new year. It's 4 p.m. May I have a roll call, please?
Mr. Pig,
I am here.
Dr. Henry,
Yes.
Ms. Stidham,
Here.
Mr. Deal.
Here.
Taylor. Here.
Quorum has been established. The meeting is now to order. Ms. Henry, would you please read the mission and vision and purpose?
Sure. Mission is to promote positive health outcomes through delivery of foundational public health services. The vision is a healthy Jefferson County. And the purpose of the health center, the Jefferson County Health Department is established, maintained, and operated for the improvement of health of all inhabitants of Jefferson County.
Thank you very much. May I have a motion to approve the agenda as presented?
So moved.
A second.
Have a first and second. Any discussion on the matter? Not hearing any. All in favor, please say aye. Aye.
Aye.
Any opposed? Motion carries. Welcome of guests. I don't see any guests. We have staff here, so welcome to the staff. Next on our agenda is approval of the December 30th, 2024 meeting minutes.
Make a motion to approve the minutes from December 30th, 2024.
Make a motion to second it.
We have a first and second. Is there any discussion on the matter? Not hearing any. All in favor, please say aye. Aye.
Aye.
I abstain. I wasn't present.
Any opposed? Motion carries 4 and 1 abstention. Next is approval of December 2024 expenditures for $138,054.76.
I make a motion to approve.
I'll second.
I have a first and second. Is there any discussion on the matter? Not hearing any. All in favor, please say aye. Aye. Any
Aye.
opposed? Sorry, Dennis. Any opposed? Motion carries. Pardon me. Next is the approval of the December 2024 electronic payments for $489,024.58.
I'll make a motion to approve December 2024.
First, I have a second.
I'll second.
Having a first and second, is there any discussion on the matter? Not hearing any. All in favor, please say aye. Aye.
Aye.
Aye.
Any opposed? Motion carries. Next on the agenda is the pre-approval of the February 2025 electronic payments for $647,247.00.
Make a motion that we approve February electronic payments 2025.
Do I have a second, please?
Second.
Having a first and second, is there any discussion on the matter? Not hearing any. The motion, not hearing any. All in favor, please say aye. Aye.
Aye.
Any opposed? Motion carries. Sorry about that. All right, next on the agenda is the director's report. Ms. Sykes, Mr. Sykes.
Okay, first on my report, I want to talk about another project that we're gonna begin. It's called the FAB Readiness Assessment. I'm sure Mr. Deal is familiar with FAB. FAB is a Public Health Accreditation Board, and this is more on the national level. We are currently Mitch accredited and have been for quite a while. And that is the state level of accreditation. What we are going to do is, it's called the Readiness Assessment. And what this will help us do is to see if how closely we do align with the FAB requirements. It's a review of our facility that's not as intense as the full accreditation process. So the accreditation assesses our department's capacity to carry out the 10 essential public health services and the foundational capabilities. And so this assessment will identify strengths and areas for improvement and assess capacity in key areas of public health. And the reason we delayed this because we had so many other projects going on. We just didn't feel like we had time to do it, but we feel like now is a good time, good opportunity for us. The assessment will be paid for by the state health department through a project they have set up. And once we complete the assessment, we will be eligible for some incentive funding as well from the state. So we've met with the managers. We think we have the people in place to start this project. Once we complete this, we will look and see if we want to go to the next step of going for full FAB accreditation, which will be a huge project. And there's a huge price tag to that as well. So we'll bring that forward to the board at that time, see what we think about doing, if we want to do that or not.
Is this in addition to Mitch or is it in place of Mitch?
Well, Mitch is the state, more of the state level, and FAB is a national level. So it's a little more intense, a lot more involved, I think, on that. So I don't know, do you typically replace Mitch? I don't know if Dennis, are you still on Mitch's board?
No, I'm not, but, a lot of the, LPHAs that have FAB, accreditation have both FAB and Mitch. I have a PowerPoint that explains the differences and the similarities of those two. I could send that out to the board if you like.
That'd be excellent, thank you.
Steve, so I think you mentioned, there is a pretty significant financial requirement for this. Is the state willing to pay part of that, all of it? How's that going to work, or don't we know?
I'm not sure about the actual full accreditation, what they will pay or not. This is just for the first part of the readiness assessment that they will pay for on that. It was, I think, $1,400 something, you remember, $1,200 for the assessment. FAB, was it 5,000? 10? It's based on population and they have a chart. Yeah, okay. So we will look at that and see if we
So
want to do that.
my question would be is what are we gonna get? What's our return on this investment? What are we getting?
We get a plaque, so, yeah,
You know what I'm saying?
yeah. Well, it's supposed to help you look at your health department and those 10 essential public health services and see where you are at with those. Where are your weaknesses and your strengths, and help you improve your health department. Is it gonna help us get funding? Not necessarily, but it's something you can put on applications when you apply for grants that they may look at and say, hey, if they're willing to do FAB accreditation, that may help us in our ranking of getting a grant or some other funding. But I don't know if it's gonna.
Things you read see,
Yeah,
that's all. I mean, that'll help the cause, is what I'm saying.
yeah. And Brian, do you have anything else on that?
No, I mean, you covered it. I mean, in addition to that, there is incentive funding that if we complete it by that May 1st, the state does.
Right.
Put us some kind
For
of.
the
So
assessment.
technically doing the readiness assessment, there is a little bit of a return on investment for that.
Next, I have just a quick discussion about our food and beverage permits for 2025. The environmental staff has worked really hard the last few years to improve how that process is done. And I think this is probably the best year we've had on people getting their permits on time or closely on time. We only have around 40 permits left for people to renew, which is probably has to be a record. And so what we will be doing on the first Tuesday in February, those facilities that are still remaining, they will be notified to try to get them in and get their permits paid. If not, they will be closed. But we've sent out letters I think we've had, was it 2 rounds of letters that went out? Or-
3 rounds of letters
3 rounds?
before, and then a late fee, and then we sent another round, I think, last week.
So we feel like we've given them plenty of notice on this, and so, but hopefully we'll have it down to where no one will be closed for failure to pay their permit fees, but that will take place, February, I think it's February 3rd. That will do that. Just give you a heads up on this. The new governor, Mike Kehoe, did appoint a new director of Department of Health, Susan Wilson, who this appointing will take effect February 14th. She replaces our current director, Paula Nicholson. She was appointed acting director in 2022 and then became full director in 2023. She was we were on a call the other day, and she gave her final address. But this is fairly typical when you get a new governor, you have some turnover there, but we will have I don't know much about her. I believe she's a nurse at is it a nursing facility? Can't remember now.
She was part of MHA, Missouri Hospital Association. She
Yeah.
worked there.
So she will be the new director of the State Health Department. Finally, went in on a good positive note. I received an email from one of the facilities that is served by our wellness van team, and I wanted to read that to the board. Says, my name is Jennifer Dixon, and I am the Director of Nursing at My Place 2. I believe My Place 2 is in DeSoto. I'm reaching out to let you know how valuable the health van visits are to our facility, but most of all, our residents. My Place 2 cares for 50 people with developmental disabilities, from autism to Down syndrome to TBIs. The van comes in monthly and draws labs, so the residents don't have to make special trips to the doctor's office. Plus, the love and care they receive from Debbie and Mary is amazing. Our residents are excited to visit with them when they are due for labs. Debbie and Mary are also open to our residents just popping onto the van for a visit. They give hugs, ask them about their lives, and make them feel special. This is above and beyond the care they receive at doctor's office visits. Beyond the care, Debbie is always willing to stop by and pick up specimens or drop off supplies if necessary. She is passionate about our residents, and it shows. I wanted to compliment their service to our facility and let you know how lucky JCHD is to have them as employees. So I just thought was good to read and let you all know how, we are getting a new van, so you can see that service is greatly appreciated out there by some of our residents. And that is my report. Any questions on anything?
Steve, could I just say too, congratulations to the environmental folks, not only for the permit process that you talked about earlier, but I thought that the article that the leader published a week or two ago about the inspection reports should have been very helpful to anyone who is interested in that. So I thought be great to just say good job for those folks.
Thank you for pointing that out. I forgot to mention that. We'll pass that on.
Thanks.
That's it.
Any other comments? All righty. Next on the agenda is public comments. There is no one here for public comments. There is I guess there is old business, new building updates. Well,
Yeah, so we hadn't had a building meeting on site since the beginning of December. We canceled because of the holidays and the weather got bad. So we did have one this morning. Things are moving right along. I know I keep saying this, but they're right on track. They feel like April 10th is still the date of where we'll go through and do the punch list. I asked today, how's that typically look? Depending on how many things we find that they need to correct, we can expect a week and a half to 2 weeks. before they actually turn the facility over to us. You know, that most everything right now is they're inside and the building is heated, so there's not much reason for delay. The parking lot will be the next big thing outside, so will be weather dependent, and will be in March, so we could get some spring rains that could move that back. But hopefully, I'm thinking May, we will be moved into the facility. But they've got the cabinets in, they're installing doors. I believe phase one, which is the clinic area, they will have the floors installed within 2 weeks. So that'll be done. They did tell us that the moisture level in the concrete is low enough that we don't have to put any special sealants down, which would have been roughly about $50,000, but to do that. So at this point, it doesn't look like we'll have to do that. We're still working on the furniture, wayfinding signs, the IT infrastructure, and our key matrix. All those things have been taking time to work through. Does the board wish to try to do a tour or not? Or do you want to just get with me if you want to go look at the building on an individual basis? I know it's hard to get together and do that. You guys can just think about it and let me know.
It's up to you guys. I was there today because we had the meeting. It's coming along quite well.
So
Maybe we could do it near next month's meeting.
do it after the meeting.
Yeah.
Okay. Or
Better.
that'll be fairly late. Is that okay? I mean, late in the day.
We can move the meeting up to 3 and then go after. That works for everybody.
Dennis, does that work for you to go to the building?
It's, as far as I know, it will, Steve. I know I was planning to attend the meeting.
Do that. We'll have a meeting. We'll start at 3 and then we'll go to the building afterwards. And the report does have the financial reports as well, and that where we're at.
So what does that look like to move everybody over and start, what does that look like?
Yeah, well.
Chaos.
Yeah, that's what I was like.
Still working on that plan.
We've met 2 or 3 times, the admin team working through that, and it's a lot of it, I'm not throwing it all on Melissa, but a lot of it is our clinical,
Sure.
how to get that transitioned over. I think most of the other staff, it's not gonna be as difficult. But moving because we're gonna use a lot of the equipment and move it over there. So we are gonna hire a moving company to help get a lot of the bigger items over. We're working now, we talked with the contractor today to try to get some of our vaccine refrigerators moved over so that, because they have to be approved by the state when you move the vaccine in the refrigerators. It has to, there's a timing of how many days that it has to sit there and get the proper temperature readings and be monitored. So they felt like that would be no problem. We could move that early, have them plugged in, and then we can move vaccine over and everything else could go. So, you know, we're still working on IT, that's getting that supplies ordered. That's gonna be the other thing of how to shut this building down and go live over there, how many days. Our CMIT, they feel like that it could be a matter of they maybe come in on a Friday and work the weekend and we're ready to go on Monday. That's a great hope.
So there wouldn't be like a disruption in seeing, or maybe a day or 2.
I think we may have a day or 2. If we can do it like that, I'd be happy if that's all. But that's kind of what we're trying to work through, how that process looks like.
You have a lot of your vendors still wanting to come here.
I happened by chance to sit in on part of one of those meetings. I was impressed with, how organized everything was.
Thank you. Yeah. It's a little overwhelming task because there's so many unknowns on how that's going to work, but I think we'll work through it. One way or the other, we'll get over there. How's that?
Right.
We're gonna have an open house too?
But
Yeah, we're gonna
Working
start
on that.
Ribbon
planning
cutting
on that.
house.
Yeah,
Yeah.
Absolutely.
We plan on doing an open house and then have like our services set up where people can, not only are they looking at the building, the facility, but they also look at the services that we provide. You know, the van will be fairly new, it'll only be a month or two old then, so we'll have that on site. Well, all of our vans will be there. So we'll use it as a way to promote our services as well as show off the facility as well. One other thing that I will be doing is sending out, we're gonna have to develop our dedication plaque and want some input from the board of how that looks and what's on that plaque. So we may come up with a couple of plaques and let you all decide what would be best. So look for that, because that's something we need to get on pretty quickly. That's it, I guess.
Okay,
Very good.
any questions, comments? All righty. So new business, one and only thing at this point in time is the first reading of the Jefferson County Health Center surplus policy. Did everybody have the opportunity to review that?
Yes,
Okay. So I'm looking for a motion to do the first reading.
Make a motion.
Do I have a second on that motion?
Second.
Okay, first, second. Steve, you want to go ahead and talk about this for,
So we have a process now of how to get rid of surplus items that we no longer use. But we don't have it's not really formal with the board. And I was talking to Tim, this came about with the discussion with our Mercedes vans and how we should try to sell them or not sell them or whatever. And he asked about our policy and I told him we didn't. We would come to you like when we sold the old wellness van, we brought that forward. I don't think we actually voted, but we did inform you of what our intentions were. But Tim was talking about probably needed to go through a process with the board on some of these assets. So Mr. Crawford put together a policy and we sent it to Christie and she reviewed it. And you didn't make a whole lot of changes, did you? I complimented Steve on that. So this would give us a process, a formal process of bringing surplus items that still have quite a bit of value to the board for you all to approve that. But yet we can still sell items through our normal process. So that's what we have written out here.
okay. So this is the Jefferson County Health Center, surplus property policy. Does anybody have any questions for Steve? All right,
how many readings do we need on that?
this will be two.
Okay.
Right? You said two, you said first, so I'm assuming there's a second. I'm only gonna read the first paragraph. It says obsolete property or property that is no longer necessary to the mission of the agency shall be disposed of by submitting a request of surplus property form with approximate value assigned to each surplus item. Requests for the surplus property must be submitted by the supervisor of each department through their manager. It goes on to talk about the actual limits of dollars. Anything over $25,000 must be approved by the full board. Any questions, opinions, thoughts before I ask for the vote?
So it says we'll accept bids to purchase those. Do the bids have to meet the amount that we thought that the items were worth?
You can always put on a reserve price, that's what you're asking. So you can, so if you think it's worth, you know, just suggesting that you're gonna get $20,000 or $30,000 out of it, you can put a reserve price of, you know, say 20 to make sure you do get a nominal amount out of it.
And I can see where some things, you know, you may not get the amount that you reserve for, and I think that's where the board would have to decide if we would accept bids under that reserved amount and make that call as we need to.
Steve, do you use gov bids or how do you
Gov deals,
gov deals?
yeah, it's a nationwide, actually, I think it's worldwide, most likely,
Yeah,
but
it's worldwide.
a lot of government agencies put their surplus assets on this site. and-
State does as well.
Yeah, and so anybody can bid on those items. It's worked really well for us to get rid of a lot of our surplus items.
Any other questions? Not hearing any, Ms. Pinkley, would you do a roll call, please, on the vote?
Mr. Pig,
Yes.
Dr. Henry,
Yes.
Ms. Stidham,
Yes.
Mr. Deal,
Yes,
Ms. Taylor.
Yes.
First reading passes unanimously. Next on the agenda is approval of the grant application for Jefferson Foundation. Would somebody like to make a motion for that, please?
I would make a motion to approve the grant application for the Jefferson Foundation.
Do I have a second?
I'll second.
First and second. Mr. Sykes,
Yeah, I'm gonna ask Katie to come forward. She's gonna.
I'll pass over.
Hi, I'm Katie. I'm an Office Support Services Supervisor here at the Health Department. The Jefferson Foundation, you guys have the board request in your packet. But just a couple things I wanted to highlight on is, well, first of all, we've been getting this grant since 2016. And I could tell you hundreds and hundreds of stories of how funding from this grant has helped our community, but we don't have all night. So I'm not gonna do that. But anyway, the funding will continue to allow Jefferson County Health Department to meet citizens where they live and work, to expand community-based clinical services, support preventative measures, including lab testing, nutrition management, primary care, dental care, immunizations, treatments to prevent further advancement of conditions, and life-saving prevention services. Over the course of the last grant, which we're actually still in the middle of, we've broadened our Project Lifesaver program as well, which is the tracking devices that we do through, in collaboration with the Jefferson County Sheriff's Office, for folks who may wander. So we were able to broaden that program with this. Additionally, this new grant funding would be used to expand our current lead testing capabilities. There is a device that the environmental department needs in order to, what does that device do?
It's got an XRF.
Yeah.
It can read the level of lead. Typically lead paint in like walls or in toys, whatever, it can tell you what the level of lead, if there is any lead present, and in soils as well.
So you take that into the home for testing, on home?
You can, yes,
testing?
yes.
And I think right now we're using one that has been loaned to us by the state. And so we'd like to get our own. So we're, you can request up to $250,000. In the past, we've always been awarded $175,000. We've requested this time, we will, if you guys are okay with it, request $200,000 and include that pricing for that XRF. Any questions?
Are we using it for the painting as well or not?
Not this one.
One question, do you get extra funds, because of the EPA designating Jefferson County as a super
Superfund site.
Do you get anything extra for that or separate funding?
We do have a
Grant for
super
that?
fund, we have a grant, a super fund, grant with the state. It's
Contract,
passed, yeah, it's a contract, not a grant. Sorry, Kristen. It's EPA provides that funding to the state, and there's several agencies in the state that have those super fund contracts, and we have one as well.
And this designation has been years back. I mean, this didn't happen. This has been because of the lead.
Right.
Basically the whole county.
Yeah, that's what I was thinking.
Everyone kind of focuses on Herculaneum, but it's not.
Because of St. Joe lead, yeah.
Yeah.
I was actually looking for that date, and then when I came in here, I noticed there's a plaque that says Superfund something something from 2003. So I feel like it's been a significant amount of time.
Mhm.
All right, is there any other questions? Okay, this is approval for the grant application of the Jefferson Foundation.
Thank you.
Thank you. Yes, not hearing any other questions. All in favor, please say aye. Aye.
Aye.
Any opposed? Motion carries. Apply for the grant, please.
Mhm.
All right, looking for entertaining any topics for the next agenda? Speak today. No major topics. All right. Move on to closed session. I know we have minutes we have to address, so need a motion to go into closed session.
Make a motion and move into closed session.
I second it.
This is pursuant to 610.021. Any confidential or privileged communication between the Board of Trustees of Jefferson County Health Department and its representatives and its attorneys, hiring, firing, discipline, or promoting a particular employee by the public or governmental body when personal information about the employee is discussed or recorded, and records which are protected from disclosure by law. Roll call, please.
Mr. Pig,
Yes.
Dr. Henry,
Yes.
Ms. Stidham. Yes. Mr. Deal,
Yes.
Ms. Taylor.
Yes.
We will not come back as to report out because there will be nothing to report out. But thank you.
Thank you.